Hi there. Thanks for joining me. Today, our topic is cardiovascular disease. We are going to see a patient and we are going to present cardiovascular diseases that she may develop if she don't manage her pre-existing condition. Before we go to the room, our patient's name is Mary Jenkins. She is 55 years old woman. She has diabetes. She is also using opioid and she's dependent on it for her chronic back pain. She is caring for her 8-month-old grandchild because her daughter is in prison. And she also works as full time administrative assistant. Hi there, Miss Mary. My name is Sid Sarmiento. I am here to present to you a few of the cardiovascular disease. According to the chart or to your chart, you have a diabetes and you're also using an opioid for your chronic back pain. With your pre existing conditions, you may be at high risk of developing cardiovascular disease. Several cardiovascular disorder that may develop over time if you do not take care of your diabetes and your opioid dependency are heart failure, arrhythmias such as atrial fibrillation, myocardial infarction, angina, or coronary heart disease. My presentation aims to be aware of the signs and symptoms of a few cardiovascular disorders. The first cardiovascular disorder that I want to mention to you is called heart failure. Heart failure is a result from the inability of the heart to contract a sufficient amount of blood forcefully to the body. Sodium and water are accumulated by the body to compensate for the reduced cardiac output, resulting in congestion of the systemic and pulmonary venous system. The pulmonary system transports blood from the right ventricle to the lungs to pick up blood, and the systemic system transports oxygenated blood to the rest of the body via the left ventricle. Further distance of the ventricles lead to overstretching of the cardiac muscle fiber. The cause of heart failure is classified as either systolic or diastolic. Systolic, which is a diminished contractile force of the left ventricle, and diastolic, which is the impaired ventricular filling. Systolic impairment accounts for 60% of heart failure and results in a reduced ejection fraction. Signs and symptoms of heart failure um, depends on the affected ventricle. A typical display of heart failure includes dyspnea, edema, and fatigue. Some patients gain 2 to 3 pounds unintentionally. This weight gain could attribute to fluid overload and edema. The next cardiovascular disease that I want to mention to you is called angina or coronary heart disease. This disease is a condition in which a blood flow to the heart muscle is disrupted due to a thermomatous plaque. The plaque can start from childhood and eventually can progress to coronary heart disease. Factors associated are environmental factor, genetics, and coexistent medical condition. Risk factors for coronary heart disease include diabetes, hypertension, smoker, obesity, stress, and inactivity. Diabetes and hypertension had an increase in the risk of developing ischemia. Coronary heart disease is the leading cause of death in people with diabetes. Signs and symptoms of coronary heart disease. The primary symptoms in acute and chronic angina is chest pain. Others may include substernal discomfort or pain described as pressure, tightness, choking, and squeezing feeling. The pain usually radiates to the arm, to the neck, shoulder, and jaw may be involved. Symptoms may include fatigue, dyspnea, anxiety, nausea, and diaphoresis. There's two types of angina: stable and unstable angina. Stable angina consists of pain with exertion or emotional stress and relief with rest or nitroglycerin. Unstable angina develop at rest with minimal to no exertion, and the pain usually stays in a prolonged period of time. The next cardiovascular disease is called myocardial infarct or heart attack. Heart attack results from complete obstruction of the coronary artery leading to myocardial cell death or necrosis. The infarcted area fails to contract, limiting the heart's muscular function. The most common cause of MI is coronary artery disease, and which affected more than 16 million Americans. Other reasons includes coronary artery spasm, emboli, and the use of cocaine. Early management and diagnosis are important to minimize the myocardial damage and patient's mortality. Signs and symptoms of heart attack. The most common presentation is described as heavy substernal pressure on the chest that may spread to the arm, shoulder, or jaw. The pain stays in longer duration and is not relieved by rest or nitroglycerin. Associated symptoms include dyspnea, anxiety, nausea, vomiting, and diaphoresis. The next cardiovascular disease is called conduction disorder and arrhythmias. Transmission and initiation of the heart requires a specific cardiac conduction system. This system is responsible for spontaneously discharging and spreading electrical impulses throughout the heart muscle. The SA node or sinoatrial node is where the impulses originated. Then it travels to the AV node, then to the His Purkinje system branches, then finally spread to the ventricles. SA node discharges the fastest under the normal condition, so the SA node is considered the dominant pacemaker and is responsible for setting the pulse at 60 to 100 beats per minute. If the SA node fails, the AV node, which is the atrioventricular node, became dominant and the heart rate is slower, between 40 to 60 beats per minute. If the heart rate is less than 60, it is called bradycardia. If it's more than 100 beats per minute, it is called tachycardia. Now, in cardiac arrhythmias, there is a disruption of the formation and or impulse conduction. Stimuli that can alter the pacing of the heart are exercise, emotion, fever, ischemia, electrolyte imbalance, thyroid disorder, and drug toxicities. Opioid use may increase a person to develop atrial fibrillation. Atrial fibrillation caused by chaotic, irregular electrical impulses in the atria that could lead to stroke. Severe emotional or physical stress, opioid withdrawal has the higher risk of developing a condition called broken heart syndrome. When this occurs, the heart pumping chamber, which is the left ventricle, weakens. Signs and symptoms. General signs and symptoms include heart palpitation, feeling of skip beats, dizziness, lightheadedness, chest pain, and syncopal episode. The most common presentation includes dyspnea, fatigue, and exercise intolerance. Ms. Mary, I am hoping that you learned something from my presentation. I encourage you to manage your diabetes and your opioid use. Please consult your doctor if you feel any of the signs and symptoms that I present to you. Take care of your health, do exercise, and have a healthy diet. Remember, prevention is better than cure. Thank you.